Today on The State of Us, reaching for pills in America, the state of mental health. Welcome to The State of Us. I'm your host, Justin T. Weller, joined today by the one and only, your friendly redneck liberal and the senior resident historian here at True Chat, Mr. Lance L. Jackson. Today, we're talking about Americans feeling unmoored and reaching for pills, according to an article in the New York Times. And we're also looking at, from the Wall Street Journal, how old ratios are clouding gaps in mental health care. What is the state of mental health? Well, we're going to endeavor to answer that in the last segment today. But before we get there, we're going to take some time to talk about the medications, a little bit of history about these medications, the prevalence of their use, and who's prescribing them. Because that is, at least to me when reading this, a huge portion of the equation. But before we dive in, Lance, do we have a word of the day?
We do. The word of the day is demystify. 4 syllables, demystify. It is a verb, demystified or demystifying, but it means to remove the mystery or mystique from, or to make rational or comprehensible, to clarify. Justin, I'm going to start by asking you a question. What's the difference between anxiety and depression? Because they kept bouncing back and forth like they were two different things. And so demystify this idea of mine that I have that, well, what's the difference between depression and anxiety?
Before I answer those two items, I think, what percentage of Americans are we really talking about here, right? Because on this show, we try to help people understand why they should care. And there might be some listeners out there who are thinking, Lance, well, this is a relatively isolated thing. I mean, yeah, people struggle with this and it's an important issue, but are there really that many people? Well, in 2019, the Centers for Disease Control and Prevention estimated that 15.8% of American adults took prescription pills for mental health. Now, that was in 2019. However, during the pandemic, the National Center for Health Statistics teamed up with the Census Bureau to carry out a quick online pulse survey that tracked mental health and prescription pill use. The numbers are surprising. We are depressed, anxious, tired, and distracted. What's new is this: almost a quarter of Americans over the age of 18 are now medicated for one or more of these conditions. 1 in 4, Lance.
That's
so if 2 more people came into this room, one of the 4 of us, for sure, right? I mean, on average,
is the average, right?
Is going to be taking medication for this.
Well, I mean,
and that's just the people. Right. I mean, that's just the people that are getting medicated for it.
Yeah.
We're not even talking about the people that aren't getting medicated who might need to be.
I've been out of the classroom for the last 4 or 5 years. I retired from teaching, but then went to the colleges and then went back as a long-term sub. And I can tell you that as my teaching career continued, from 1985 to 2017, 2018, I saw the number of students go up, and that's just working with high school and college age students, and you're talking about the entire country being in education and having to read the forms and fill out forms for doctors to get students on medication to help them perform better in school. It's higher than I thought, but not out of the realm of understanding.
One thing, obviously before we continue, is an important component of, for our listeners, if you've listened a long time, you would know that Lance spent many years as a professional educator, many decades, and is working as an intervention specialist now. I spent a number of years studying psychology. It's what I thought I wanted a degree in college in, but never finished. So hopefully while we both have some relevant experience, I also work with children now who are definitely faced with some of these challenges. Neither one of us are obviously professionals in the industry. So if we do have some professionals out there listening, we ask for forgiveness if we mess up. But we're trying to...
And don't take anything we say as, oh, this is what we ought to go do.
Right. Yeah.
Because we're not giving mental health care suggestions. We're just talking about the topic and how it's affecting people across the country.
Yeah, mostly relaying information from official sources in a way that hopefully helps people better understand what's going on. I actually do have a psychologist in my family, a couple psychologists in the family.
Me as well.
And from a personal standpoint, while I cannot speak to all of this, I can tell folks that I have personally been and taken Prozac before, which is one of the main drugs that we'll talk about today. But one of the big things that you're going to find out is
I've eaten double cheeseburgers though in moments of stress.
Gotcha.
So that's my drug of choice.
Trying to really up the reward system there and let it go.
It's not good for you, but that's where I generally turn.
So, we'll speak from the personal experience we do have, but that's what it is. So Lance asked us about anxiety and depression. And I think one of the reasons this question came up is Lance highlighted in this article that, quote, the 1950s and 60s were widely framed as the age of anxiety, said Anne Harrington, the author of Mind Fixers, Psychiatry's Troubled Search for the Biology of Mental Illness. And she's a historian of science at Harvard. The 80s and 90s became the age of depression, and yet it's unclear that people's symptoms actually changed. So Lance's question of, well, what is depression and anxiety? Are they the same? Well, one thing that I did, hopefully to try to help illustrate this, is I printed for Lance what I think is a decent Venn diagram. We're pulling out some school terms here, right? That's one of those circle charts where there's two circles and they overlap in the middle. You put the differences on the outside and the things that are the same in the middle. So I'm going to tell you the definition, and then we'll let Lance try to make sense of it here. Depression is a negative, and by the way, both definitions we're using are from the American Psychological Association, from their dictionary, okay? Also important, not to bog people down in the weeds, but a definition of this is not the same thing as the criteria for diagnosis. Okay, that is a separate set of criteria found in the Diagnostic and Statistical Manual for Mental Illness, which is not what we're talking about. We're just talking about the definition from their dictionary. So depression is a negative affective state ranging from unhappiness and discontent to an extreme feeling of sadness, pessimism, and despondency that interferes with daily life.
And that was what?
Depression.
Various
physical, cognitive, and social changes also tend to co-occur, including altered eating or sleeping habits, lack of energy or motivation, difficulty concentrating or making decisions, and withdrawal from social activities. It is symptomatic of a number of mental health disorders. Now, anxiety. So what I want to highlight again here for you is ranging from unhappiness to discontent and an extreme feeling of sadness, pessimism, and despondency, depression, okay?
Mm-hmm.
Anxiety is an emotion characterized by apprehension and somatic symptoms of tension in which an individual anticipates impending danger, catastrophe, or misfortune. The body often mobilizes itself to meet the perceived threat. Muscles become tense, breathing is faster, and the heart beats more rapidly. Anxiety may be distinguished from fear, both conceptually and physiologically, although the two terms are often used interchangeably. Anxiety is considered a future-oriented, long-acting response that is broadly focused on a diffuse threat, whereas fear is an appropriate, present-oriented, and short-lived response to a clearly identifiable and specific threat. So, Lance, I've given you those from the American Psychological Association. You've got the chart.
Right.
We kind of did this backwards. We gave Lance the chart today. So,
well, I'm the visual learner.
What do they have in common?
You just said all of that, and I'm jotting down notes on my Venn diagram because it helps me make sense of it. Well, it looks like, anxiety. It says it has mental symptoms and physical symptoms. The mental symptoms of anxiety: fear of injury, illness, or death, excessive worrying about things going wrong, racing thoughts. And physical symptoms would be elevated heart rate, dizziness, sweating, rapid breathing. So, and then there are the overlapped mental symptoms that are found in both anxiety and depression would be difficulty concentrating and irritability, And the physical symptoms that overlap are digestive upsets, appetite and weight changes, sleep difficulty. So I'm thinking about my entire life, right? My life as a whole. And I would really have a hard time saying that I've ever had anxiety. There's occasionally with retirement and the pandemic, again, what's the word excessive mean? But the only thing in the mental side of it is excessive worrying about things going wrong. And for me, the physical symptoms of anxiety, I've never had. I can just cross those out. That doesn't fit any feeling that I've ever had in my 60 plus years of being on this earth. But within the depression side, the mental symptoms of depression, feeling hopeless, loss of interest in hobbies or pleasurable activities, thoughts of death or suicide. Now, to me, that's extreme, but not to make fun of it because people have that. And unfortunately, as an educator and a coach, I've talked to way too many young people with those thoughts, and some who unfortunately acted on that. Some I talked to, some I didn't. The physical symptoms of depression, moving or talking more slowly than usual, decreased energy, aches and pains without apparent cause. Okay, as I look at this, and I would have thought in my little bit that I've read about it, I would have said they're pretty much the same. They're not at all. And I can go back in the history of my life and think of times in my life where I have fit the depressive group, much more so than anxiety. Like I said, the overlapping ones, I'm right there with them. That's where I am. That's where I am the most in my life, is the overlapping ones, the mental symptoms, difficulty concentrating and irritability, along with the physical ones, digestive upsets, appetite and weight changes, sleep difficulty. That describes the general state of my life. So I don't know. Am I doctor? I know you're not a doctor. Sorry, I don't want to get people that way. But so where does that put me? I don't see anything that in my life describes having anxiety other than the overlapping things. But I can pick out times in my life where, other than the thoughts of death and suicide, I've had depression.
Yeah. Well, and I think that part of what we're trying to distinguish here for folks is a couple things. Number one is that the group of depressive disorders, right, which is huge because depression is, as hopefully is clear, it's a very broad term, right? It encompasses a lot of different things, including things like altered eating or sleeping habits, right? Lack of energy, motivation, difficulty concentrating, making decisions. You may not necessarily experience all those things, right? So one of the things is depression is common, and in breaking down that stigma, there's a decent chance, that sometime during your life you will become depressed, right? Now, does that mean that you'll be depressed forever? No. You may very well come out of that, right? Now, whether or not it arrives at a clinical level of requiring treatment, well, that's a question for the professionals, right? But I think that's part of breaking down that stigma, as Lance tried to explain there, of these are natural things for people to experience. The other thing is with anxiety, again, often misunderstood, for fear and anxiety are the same. And from a psychological standpoint and physiologically, they cause different things to happen in the body, right? So we have all, at one point or another, probably experienced fear. We have also all probably experienced some type of anxiety. Whether or not it rises to the definition of what's being described here, well, again, that's changes from person to person.
But you mentioned something, and I know we're going to talk about something here in a little bit, but maybe it's never risen to the level of seeing a professional about it. Are people seeing a professional now who's diagnosing all of these people with the rise in mental health issues in the United States these days?
A couple of weeks ago, Lance, the Wall Street Journal reported that 1 in 6 calls to the National Suicide Prevention Lifeline were abandoned before they were answered because the call centers were understaffed and overstretched. So 1 in 6 calls If you're an unlucky one of the 6, right, your call might not get answered.
And that's just a hotline. That's not necessarily a professional, because I've worked on a hotline before.
Right. I mean, it is the national hotline, and they do get training, but it's not like you're necessarily getting connected with a psychologist or psychiatrist. You're getting connected with somebody who's received some basic training on how to try to help get you to the resources that can help you more.
Because I worked on that when I first became a teacher. I went through the classes and worked on that hotline for a couple of years.
And by the way, we'll mention it again later in the show, but they have updated that number, that phone number, and they've tried to make it easier for folks to remember. So we dial 911 for emergencies, right, Lance? Well, you can dial 988 for the National Suicide Prevention Lifeline. So,
like to be able to get that information out to folks.
Yes, 988. That should be easier to remember than the full 800 number that they once had. So, okay, let's keep talking about it. Keep it here on The State of Us. We'll be right back. We tried to break down some of the differences between anxiety and depression, but part of what's tricky, and I think this is what the article highlights, right? As we talked about before, remember that almost a quarter of Americans over the age of 18 are now medicated for one or more of these conditions, okay? And that includes, by the way, depression, anxiety, being tired, being distracted, okay? One or more of those conditions, almost a quarter of Americans are getting medicated for. But the next thing I want to talk about, Lance, because I think this is part of when we talk about in this episode, the state of mental health in this country. Who is prescribing that medication? Now, before we tell you the data, I want you to take a minute and think about who would you assume is writing the prescriptions for things like Prozac or things like Lexapro or things like Adderall?
Well, I don't know how many people are like me, but to demystify this, my knowledge is that if I go and talk to a counselor or a psychologist, they can talk to me. But if I wanted to take drugs, I needed to see a psychiatrist.
Well, I can tell you what the article says, Lance, and that it talks about Prozac. And one of the reasons we're talking about Prozac is, historically speaking, Prozac was sort of one of the first big antidepressants on the scene. And in fact, within the first 2 years of Prozac's existence, 650,000 prescriptions were written for it per month.
And what year was that? Do we know?
Prozac arrived in 1987, and just 7 years later, a Harvard grad wrote her book, Prozac Nation, which was a blockbuster. An early devotee of such pills, she reported from the front lines of the new pharmacological war on sadness, an avatar of Gen X anguish and hope. Prozac was developed to answer, Lance, what was then the prevalent theory of depression. You asked, are these mind-altering? The prevalent theory was this. It was caused by a chemical imbalance in the brain, specifically too little serotonin. Prozac and similar drugs are called selective serotonin reuptake inhibitors, or SSRIs, meaning that they block the reabsorption of serotonin into the brain. And you might say, well, wait, they have a serotonin shortage, so why would you block reabsorption? Well, the reason is because your brain puts out serotonin, right? It distributes it out to the body, and then it comes back and it is reabsorbed into the brain, and then it goes out of the body. So by selectively blocking the reuptake of serotonin into the brain, you are keeping more serotonin in the body.
Okay.
Which in turn, again, the theory being that if you have more serotonin, you're less likely to experience some of those common symptoms of depression. And Prozac is also on-label use for treating anxiety as well.
Justin's still holding out. We haven't solved the mystery of who's prescribing the drugs. My intention would be, based on the knowledge I had before I read the article, it would be psychiatrist.
And you would be forgiven for thinking that, right? I mean, I would probably say that. A lot of you
so
out
you're
there
telling
would
me
say
I'm
that.
wrong.
Yeah,
So-
no, we're dead wrong.
Okay.
Dead wrong. As of 2013, a study then found that more than 79% of antidepressant prescriptions, 79%, so almost 8 in 10 prescriptions for antidepressants were written by primary care physicians.
General doctors.
So the people you go see, right, for your once-a-year annual checkup, 8 out of 10 of the prescriptions for antidepressants are written by them.
Well, isn't their major of study general practice? So they don't necessarily, I mean, I'll equate it to education. An elementary teacher teaching social studies in 4th grade took 1, maybe 2 classes of American history. Me being a secondary teacher and teaching high school history, I had to take 12 classes of history, 8 of which had to be American history. I took 4 to 8 times the amount of American history classes as an elementary school teacher did. Not that the elementary school teacher did a bad job, but they didn't study, at least in school, as much American history as I took. But the same thing's going on here, right? General practitioners are writing 8 out of 10 prescriptions for mental health.
I mean, I hope that sets in for a moment for people, because it isn't disparaging. I mean, in fairness,
I'm not putting them down, but that's not their area of expertise.
Their job is to try to take care of you, right? And they see a problem, so they're trying to do something about it. But the thing here is not to say, oh my gosh, isn't it terrible that these general practitioners are doing this? The point is to illustrate to people, doesn't this tell us that there's a problem? Why are general practitioners doing this? Well, that gets back to a shortage in mental health care, which we'll talk about in a moment.
Oh, not enough of something, so we have to make do with what we have. Okay.
Keep it here on The State of Us, and we'll be right back. From the New York Times article, what Lance and I ended the last segment talking about, I think, summed up here well with a few questions. Without the tools of talk therapy, one could wonder what the logic is of the prescription. Are the pills in and of themselves a cure that you could take for a certain amount of time and then find yourself transformed? Or are they a treatment that works only as long as you're still taking them, if they work at all? Existing research paints an inconclusive picture as to how effective antidepressants are compared with a placebo. Remember, that's based on, right before that, we talked about almost 8 in 10 prescriptions for antidepressants are written by your primary care physician, not by a mental health professional.
I'm still wrapping my head around it, so go ahead.
Again, the thing to point out here is, why is that happening?
From reading the article, one of the problems is there aren't enough specific mental health care professionals. But what I took away, and correct me if I'm wrong here, from reading the articles, and folks, you read them too, okay? Stop listening, go read them, come back to us. But what I took from it was that most mental health clinicians would say taking the drugs helps you if you're seeking consultation, if you're talking to someone. Sometimes the drugs are needed to listen to your therapist, but they are only using them to keep you around on Mother Earth so that you can go and get something from your consultations with your therapist. I mean, did I read that correctly or not? I mean, is that what most, all of the experts are saying? Is that, yes, these are necessary to keep folks around, but it ought to be used in relationship with having someone to talk to.
Well, Dr. Robert Ashley is a psychiatrist in Los Angeles, and the way that basically that he explains it is that his general plan, Lance, is to get them on an antidepressant, wait until they feel better or, and here's one of those lovely words, air quotes, normal, which can take 4 to 6 weeks. What we're talking about there is that most antidepressants, for example, like Prozac, right, that are SSRIs, have to have time to build in your system and stabilize. That's the other big thing. They have to stabilize in your system because you start taking them, and what you feel in the first week, you may not feel anything, but if you do feel stuff, it could be totally different than what you feel on week 4 to 6, which is when they generally consider it stabilized. So his plan is you get them on those, you wait until they feel better or normal, which somewhere in that 4 to 6 range, and then you keep them on the medication for 6 to 12 months, at which point he starts to look at a good time to take them off. Now, the key is that during all of this, he is also doing therapy with them, right?
So that's a mental health professional.
Yes.
That's not my primary. That's not my primary care physician who's doing that.
This is a medical doctor who is trained in psychology and the pharmacology of psychological disorders.
But doctors like him are only prescribing 2 out of 10 prescriptions,
right,
of what Americans are actually taking.
Well, and here's the thing that the statistic doesn't tell us actually is that it's probably not even 2 out of 10, Lance, because there's other doctors, right, with prescription writing powers who may not be mental health professionals either, who are not your primary care.
So am I safe to surmise that the majority of people ages 13 to 60 taking these drugs are being prescribed by someone other than the specialist who went to school in this area?
Yeah, I mean, that's what the data tells us. Now, whether or not they're receiving care from a mental health professional, and this is part of where I think what's illustrated in today's episode is a lack of clear data, okay? Because drawing some of these definitive conclusions is tricky as well. Because what Lance highlighted, I think, is very important. The problem is that it is possible, right, for your primary care physician to have given you a prescription and for you to be getting counseling and for those two individuals to not be talking to each other. That's 100% possible. And not even know that the other thing exists. Now, you would think you would want to tell them that, but that's not a given, right? That's not a given. Likewise, you could also have a prescription and not be getting therapy at all, and your general physician never insists that you have to get it. I can tell you, Lance, from experience that I have taken Prozac from a prescription from a general practitioner. I have done that in concert with a mental health professional, and I've done it without a mental health professional. So it definitely happens, I guess is what I'm saying. It's happened to me,
Well, now, didn't the article also state that during the pandemic, many times these drugs were given through a telehealth visit?
And here's one of the
or an online visit where I just filled out a questionnaire and then somebody sent me a prescription.
Emergency legislation that was passed in the early days of the pandemic may have helped to ease the pathway to an Adderall prescription even further. The new rules lifted the requirement that doctors see patients in person in order to prescribe them controlled substances, which Adderall is. New telehealth companies like Cerebral, which was founded in 2020, provided customers with stimulant prescriptions after a 30-minute online consultation. So in 30 minutes, Lance, somebody who's a medical doctor can decide that, we're going to put you on a controlled substance.
But if I buy stuff determined by the government to be illegal from my local street pharmacist, I'm in trouble. But if I just grab the phone or the computer and talk to somebody for 30 minutes, they can legally prescribe me stuff. I mean, I'm not trying to cast aspersions on this necessarily, because I understand. I mean, I come in contact with young people every day who are starting to do better because they're on some of these items, some of these drugs. So I see the need for it. I'm very concerned at how easy and how much it's being handed out by anybody in the general medical field. Now, obviously the counter to that, though, is if that many people need help, we need to get them the help. And if they can't get in to see somebody for 2 to 6 months to get them something, then maybe that's the problem in the system. But to me, as a novice, it's very scary that it's this easy to come across some of this stuff.
The answer is shortages in the mental health workforce for every level of staff, independent clinicians, supervisory medical level staff, all levels of the organization, according to the Wall Street Journal article. Whether or not they know it, more than 150 million Americans live in a mental health professional shortage area, according to the Health Resources and Services Administration, which is part of HHS. That statistic is hugely influential. For over a century, public health officials used it or variants to gauge whether a geographic area had enough providers. But it may be outdated because it doesn't reflect the rapid shift to mental health counseling from in-person to telehealth. By 2021, after a year of the pandemic, only 5% of most doctors' visits were via telehealth, compared with 40% of mental health visits. For mental health professionals, a shortage is declared if the ratio of people sorry, today's the day of staggering stats, Lance. It's just hard to read this one and, that's when we know it's gotten bad. For mental health professionals, a shortage is declared if the ratio of people to psychiatrists exceeds 30,000. So, until there is only one psychiatrist for 30,000 people, you don't have a shortage. I mean, again, so just what the data tells us, 1 in 4 Americans are taking medication for this, but we only declare a shortage of these individuals if the ratio exceeds one psychiatrist to 30,000 people. I'm
flabbergasted.
And that metric tells us that 150 million Americans live in an area with a shortage as defined by that metric.
Right. And we have somewhere between 75 million and 80 million people taking these drugs. 25% of the population. Between 300 million and 320 million would be 75 to 80 million people. And you only need one doctor for every 30,000 people.
To define a shortage.
Okay. I mean, I don't know what you do because, obviously the flip side of this is you have somebody who really needs the help and they're, at the far extreme, they're suicidal and they're on a 6-month waiting list to see the doctor. They may not be around in those 6 months.
Right.
So I'm very much in tune with the necessary intercession here to keep them around so that they can see a clinician. But it really seems like to me, and somebody who knows more about this than I do, please explain it, that we really are giving many, many people these prescriptions without the necessary background work being done.
And without the necessary follow-up, I think, is the other big thing. I'm not saying that
it's not necessary. I'm just saying it throws into question, is it necessary? I don't know, right? I mean, okay.
Well, I mean, just as an anecdotal example, right? We have students at the youth center. We have one in particular that we're working with. We started probably 4 weeks ago, Lance, trying to get them a psych evaluation from just a psychologist, by the way, not even a psychiatrist, right, but a psychologist. And the soonest available in our, area, unless of course you have the money to pay, for private care, and money is no object, but the soonest available based on, their insurance and everything, the soonest available for this student is in October, I think, or September. So you're talking about basically, again, for reference here, folks, that's about a 3-month wait in this case, just to get that evaluation. Now, this student is seeing a counselor, right? And is under the care of a general practitioner, is receiving medication, and is getting counseling. So there is an example there of the system is doing a good part of its job, but there's real trouble finishing.
There's a piece missing.
Yes. And so I guess the way that I would sum this up, Lance, is we don't want necessarily to start telling all of our general practitioners, oh, you can't give out these drugs,
Right.
But I think what we do have to do is say we have to commit immediately as a country to fixing how we measure these statistics, because how are we really expected to fix or address any of this if the numbers that we're using to measure it aren't reliable? And the other thing is, the way that number was created, Lance, is basically totally arbitrary. The U.S. had the equivalent of about 26,000 psychiatrists and about 240 million people in 1987. That's roughly 10,000 people for every psychiatrist. So HHS at the time, with really no explanation, just said that a geographic area with 3 times the national ratio has a shortage. That's how they came up with that.
HHS being Health and Human Services.
Yes. Which, I mean, again,
we're grasping at straws, right?
Right. We're just kind of pulling the thing out of the hat.
Here's
and saying,
what we have. So, okay, then we'll say this then makes it a shortage. But no study was done or anything else. And then, of course, the population has changed. The number of psychiatrists has changed. So based off of that math, then we come up with something for today without any real study done, because the original declaration was done without any kind of study. Yeah, I mean, wow. And we wonder why we have a mental health crisis in the United States.
I don't know if we've really demystified it for people or not. Hopefully we've broken down some of the challenges just in getting the necessary information to make good decisions.
Well, and raise some questions so that people can be better informed, right?
Yes. Because the end message I guess I would leave people with is, if you think you need help, go get it, right? I mean, do something.
Sure.
Because going at least to see your general practitioner, if that's who you can get in to see, that's definitely better than not doing anything at all, right? No, it's not, as we've highlighted. That shouldn't be the end of the line, but you got to take the first step. And the first step may be calling 988 as well, right? But talk to someone and begin the process, because as for bad as everything is, the availability of mental health care today, has improved, right? How we treat mental illness, what we try to do with it, data-informed approach, it is getting better. And we have to inform people about the shortcomings, which is what we've tried to do today, in an effort to make sure that it keeps getting better. Because I'm sorry, but the statistics that we talked about today, I think, spell out a serious challenge for mental health in this country. Why do we have this conversation, Lance?
Well, it's good to say that it's getting better, but let's not sit on our accolades and let's make it even better for folks. And why do we have it? Well, because we here at True Chat have a mission, and our mission is to educate people by providing honest, open, and respectful conversations. And I think, once again, we've met that mission. We've told you how it is, that it is better, but it is far from perfect, and we need to keep working on it. And as you talk to those in your household or in your office, and they say, well, this sounds like a kind of show that I could really enjoy, tell them as a podcast, they can find us on Spotify, Overcast, Stitcher, Apple Podcast, and everywhere podcasts are found.
The State of Us is available Tuesdays and Thursdays, released first thing in the morning as a podcast. We're also heard on the weekends on AM and FM radio stations across the country. For The State of Us, Lance takes the win today on Demystify.
4-syllable word, I had an inside advantage.
That's right. I'm Justin T. Weller.
I'm Lance Jackson.
Special thanks to producer Bradley Butch. Thank you all, our audience, for tuning in. We'll see you next time. Be the change. Be sure to check out our website, thestateofus.org, for books, articles, and all the ways to tune in. thestateofus.org.